YouTube, this is your boy the Traveling Beard back with another video. Today it is a education video. This is part of the Mortal Kombat cheat sheet. We will be going over the CIS test. Now that means essential. I'm sorry, that is for the instrument specialist. Now, to become an instrument specialist is mostly instruments that will be on the test you have to identify. But ISHM they do send you books in the mail. Basically, if you are certified, you get books in the mail, things of that nature to keep up with your education, keep up with the knowledge that is currently being updated day by day, right? So today they have given me a test, and I want to go over with you guys. We want to help you guys to obtain that CIS, the instrument specialist. If you are acquiring it, if you're thinking about going for it, if you're on the fence, I think you guys should go for it. Especially if you're going to get a little more money for it. If your facility is paying you more money for it, go for it. Let's get into some of this. Now, this is the self-study guide lesson plan quiz that they have. This is mainly for the operating room and as well as the central sterile processing technician who becomes a specialist. Now, the first one is the case pickup sheet contains the exact same information list on the preference card. Is that true or false? Once again, the case pick sheet contains the exact same information listed on the preference card. Now, the preference card is what is needed for the case. If the patient comes in needing a heart transplant, what would the patient need? The instruments, the packs, the drapes, what things that this person will need for this type of case. Now, once again, the case pick sheet contains the exact same information listed on the preference card. True or false? The answer is true. The answer is true. We all know that in order to do a pick sheet, you must know what's going to be on it. So it has to be exact for that particular patient and for that case. Next, during case setup. Now, this is during case setup. A, B, C, or D, right? A, the operating room nurse manages all care. That's A. B, the surgical technologists prepare the patient for case. C, the instruments are checked against the preference card. D, all of the above. The answer is D, all of the above. Now, this is during the case setup. This is what's being prepared for the patient to come in on the table. What needs to be done? We'll go through it so you'll know that it is all of the above. During case setup, the operating room nurse manages all care. She is the facilitator. She has to make sure that everything is flowing properly. The surgical technologist prepares the patient for the case. So the surgical technician is prepping the patient. He's letting them know this is what's going to happen. We're just gonna move slowly with this. Now, they are in the loop as well. C, the instruments are checked against the preference card. Now, you're making sure that everything aligns with the preference card, that the exact instrument on this preference card is needed for this case. D, all of the above. That was your answer. D, all of the above. All of that applies for during the case setup. Okay, that all applies. Once again, this is the Mortal Kombat cheat sheet for the Central Instrument Specialist, CIS. That stands for CIS, Instrument Specialist. If you want to obtain this, this is some things that may be on the test. When I took the test, it was generally instruments and what they are needed for, how to use them, how to break them down. But ISHM send me a self-study lesson, and this is what I'm assuming will be on the test. Next question. Case breakdown typically involves, once again, case breakdown typically involves A, the operating room nurse and the surgical technologist. B, the surgeon and the anesthesia tech. C, the operating room nurse and surgeon. D, the surgeon and the pre-op. Wow, okay. We know that's not it. Okay, and this is for case breakdown. Case breakdown typically involves, it would be A, the operating room nurse and the surgical technologist. It will be the nurse and the surgical tech. Them two basically, when the case is over, they typically break down the room as far as making sure all the instruments are accounted for, that nothing was left in the patient, that nothing was thrown out that is needed, that instruments are broken down. Now, usually you may have a rep in the case as well, breaking down his instruments that are in the case as well. But typically, it's the two, the nurse and the surgical technician. Let me do two more for you guys. When are surgical supplies open? Set up for the procedure. When are surgical supplies open and set up for the procedure? A, at the beginning of each shift. B, while the patient is in the operating room. C, as close to the time of the surgery as possible. D, once the room is available. It is C, as close to the time of the surgery. We all know once the first case breaks, they immediately clean the room and get it set up for the next surgeon to use. So it would not be once the room is available, it's as close to the time, because within that time, cases, they are a lap in certain cases. They are a big gap depending on what type of cases there are for that room. Okay? So it is C. The last one we will go over is instruments availability can be affected by add-on cases. That's A. Instruments availability can be affected by A, add-on cases. B, delayed decontamination process. C, missing instruments. D, all of the above. Instruments availability can be affected by D. That's the answer. It's all of the above. The reason why instruments availability can be affected by add-on cases, delayed decontamination process, missing instruments, and the answer would be D, all of the above. All right, guys, this is your Mortal Kombat cheat sheet. Hiya! This is brought to you by the Traveling Beard. Back with another quick vid.